Principles of sports nutrition.
Comprehensive fitness testing, generally a function of qualified personal trainers, university, kinesiology and exercise physiological departments, human performance centers, and local fitness centers, is an in-depth, precise assessment of one's level of fitness. A standard fitness appraisal consists of a body composition analysis, a maximal or submaximal aerobic test, and an assessment of your blood pressure, heart rate, muscular strength, muscular endurance, and flexibility. A fitness test puts an end to all speculation, pushing yourself to the physical extreme in a controlled, safe environment, supervised by a qualified attendant, forces you to meet yourself in a way not common to the mundane experience of sedate living. The results have different effects on those who have the courage to take the test. I've seen clients who are initially shocked, dismayed, disappointed, or thrilled at the outcome. But in the end, almost everyone is highly motivated to change or improve their state. If your physical condition is below par, reality will bite you in your weakest and most tender spot. I've seen many wake up as a consequence of this kind of reality check because the facts and the lack of fitness or presence of a phenomenal condition are impossible to deny when presented in black and white. A person can talk a good game, but let's get him or her on the ground and perform at least 20 push-ups in perfect form. That's when the real story is told. And the reason the fitness test, the appraisal, is so important is because your capacity to perform is intimately, scientifically correlated in causality with risk of morbidity and mortality. In other words, your chances of dying sooner rather than later increase as you age and your fitness deteriorates, your flexibility, your aerobic capacity, your strength. All of this can be measured, and all of it relates in part to the wholeness of your entire being and functional health. Now, once you have the results on paper, you can see things as they really are and then develop an effective strategy to increase your lean mass. You've got to be objective when it comes to this information. You can reduce unwanted body fat because you can see how much fat you've got. Or you can improve any aspect of your fitness through appropriate training. This is what a good trainer does. A good trainer will test you first to see what kind of shape you're in, and then the weakness, the fragility, the limitations of your physical form will become evident. This is how it's also done with a dietary analysis. The same idea. This is why combining the two is such a practical and beneficial process. You find out what the organism eats, you find out what kind of shape the organism is in, and then you make an assessment of the state objectively, and then you can help that organism, in this case a human organism, move forward so that there's less risk of premature death, less risk of disability, inflammation, and pain as you continue through the course of your life. Of course, what's obvious to any athlete is that routine fitness assessments can help determine whether or not you're making any improvement and where you have to focus on. Maybe you've got incredibly good flexibility, but your power and strength is low. So you go back to the gym or you talk to your coach and you work on a new power program. You focus on what it is that you need to do to turn yourself into a champion. And of course, for the non-competitive athlete, for the regular person who's just going to the gym, likes to play recreational sports, what about quality of life? Wouldn't you like to know whether you're moving towards a state that is going to diminish your experience as a human being? And wouldn't you like to know how to prevent that? This is all about prevention. This is why I love preventive medicine. It focuses on taking action before the disaster happens.